Hi, I'm Dr. Kim Vacek. I'm a clinical psychologist with the pain management program at Nebraska Medicine, and I've been asked to talk to you about using non-pharmacological strategies to help patients manage their pain. And using non-pharmacological strategies has been shown to be more effective than using just medicine alone. It gives patients a more active role in their own pain management and can help increase efficacy. One of the most important techniques that you can use from a non-pharmacological view is basically compassion, validating the patient's pain. But in addition to that, formal relaxation strategies such as diaphragmatic breathing or guided imagery are very helpful for evoking the relaxation response, otherwise known as the parasympathetic response. This is the body and the mind's natural quieting system. And with practice, using these type of techniques can really help a patient learn to combat muscular tension, reduce pain, also anger and anxiety. Today, I'm going to be teaching you a breathing technique. It's called diaphragmatic breathing, but I like to refer to it as belly breathing because a lot of times we learn to breathe through the chest, and what's going to be helpful for managing your pain and reducing it when you're struggling in between doses is this belly breathing. So the way I like to teach people is to place one hand on your chest and to place one hand on your diaphragm, which sits right below your rib cage. And what you're going to notice when you're doing this correctly is that your belly is what expands and the hand on your chest remains relatively still. So I can't do this and teach it at the same time, so just be kind of practicing as I tell you. I want you to inhale slowly through the nose for about 4 to 6 counts, and picture this diaphragm like a balloon that's going to expand fully. And watch as I do this. See how my belly is moving? And then decrease or exhale fully and completely. So again, inhale until that belly is completely expanded. Hold for just a moment and then exhale fully and completely. If you do that kind of breathing for about 30 seconds with that proper technique, it should be slow, not forced. That should help engage the part of your nervous system that's going to help quiet things down, which can quiet down the pain. One thing that I'm going to show you just an introduction to is guided imagery. Guided imagery is one of the relaxation strategies that can help engage that parasympathetic response. It involves taking the patient through their mind's eye to a relaxing and peaceful place. So somewhere like an ocean, a stream, a forest, that sort of thing. And then there will be resources on the Nebraska Medicine intranet for you to access scripts that you can take through your patients, 5 or 10 minutes. I realize that that's something that takes up your time and that you're very busy with a lot of patients and important tasks, but I can tell you that if you do take that extra time to do that for a few minutes, it's going to make that patient's experience and probably your experience a little bit better and more effective in terms of managing their pain. In addition to guided imagery, hopefully you will have access to things like progressive muscle relaxation, which also engages the parasympathetic response, taking the patient through the different major muscle groups in their body and relaxing each one by one. So this is an example of a guided imagery exercise. We're going to go to the forest. And what I want you to focus on is not only imagining what you might be seeing in this scene, but I want you to try and engage all your senses. Your sense of sight, what you might be hearing, for example, the rustling of the wind through the trees, what you might be smelling, the smell of pine when you're inhaling. The more you engage the senses, the more you're engaging different parts of the brain and the more effective the relaxation experience will be. So begin with your deep breathing and just start to imagine that you're walking through a path deep in the forest. Look around you, and all around there are tall trees, pine wood, oak, fir trees. Try to see them. Hear the rushing sound of the wind.